Pregnancy, a time of joy and anticipation, can also be a time of anxiety, especially when the well-being of the unborn child is at stake. One of the silent guardians of a healthy pregnancy is a seemingly simple procedure known as a cervical cerclage. This procedure, often referred to as a cervical stitch, plays a crucial role in preventing pregnancy loss in women with a weakened cervix. The cervix, the lower part of the uterus that connects to the vagina, acts as a gateway during pregnancy. It remains tightly closed, holding the developing baby securely within the womb. However, in some cases, the cervix may begin to shorten or open too early in pregnancy, a condition known as cervical insufficiency or incompetent cervix. This can lead to premature birth or miscarriage. Cervical cerclage offers a beacon of hope for women at risk of cervical insufficiency. By placing a strong stitch around the cervix, the procedure helps to reinforce it, keeping the cervix closed and providing the baby with the precious time needed to grow and develop. This seemingly small intervention can make a world of difference for expectant mothers and their babies. As a surgeon, I have witnessed firsthand the transformative power of cervical cerclage. It's a reminder that even in the face of adversity, medical science can offer solutions that protect and nurture life's most precious beginnings. The cervix, a small yet mighty organ, is a testament to the intricate design of the female reproductive system. As a surgeon, I've always been fascinated by its unique anatomy and its pivotal role in pregnancy. Understanding the cervix's structure is crucial for performing a successful cervical cerclage. Imagine the cervix as a cylinder-shaped structure about an inch long. It connects the vagina to the main body of the uterus, acting as a gateway between the outside world and the developing baby. The cervix has a remarkable ability to transform throughout pregnancy. In the early stages, it remains firm and closed, holding the pregnancy securely. As pregnancy progresses, the cervix gradually softens and thins in preparation for labor. The cervix's unique composition makes it both strong and flexible. It's primarily composed of connective tissue, rich in collagen and elastin fibers. These fibers provide the cervix with its strength and elasticity, allowing it to stretch and expand during childbirth. However, in cases of cervical insufficiency, this delicate balance is disrupted, and the cervix may not be strong enough to support the weight of the growing baby. Performing a cervical cerclage requires a deep understanding of the cervix's anatomy and its surrounding structures. The sutures must be placed carefully to avoid damaging the cervix or nearby blood vessels. It's a delicate procedure that demands precision and experience. Cervical insufficiency, a condition that affects about 1% of pregnant women, occurs when the cervix begins to shorten or open too early in pregnancy, usually in the second or third trimester. This weakening of the cervix can lead to premature birth or miscarriage, often without any warning signs or symptoms. The exact causes of cervical insufficiency are not fully understood. However, several factors can increase a woman's risk, including previous cervical surgery, such as a cone biopsy or LEEP procedure, congenital abnormalities of the uterus, exposure to diethylstilbestrol or DS in utero, multiple pregnancies, and a history of preterm labor or second trimester miscarriage. In some cases, cervical insufficiency may be diagnosed during a routine pelvic exam. The doctor may notice that the cervix is shorter than expected or has already begun to open. In other cases, the condition may not be detected until a woman experiences symptoms such as pelvic pressure or a feeling of fullness in the vagina, back pain or cramping, vaginal bleeding or spotting, and increased vaginal discharge. Diagnosing cervical insufficiency early is crucial for preventing pregnancy loss. Women with risk factors for the condition should be closely monitored throughout pregnancy. Section 4. A stitch in time. The cervical cerclage procedure. A cervical cerclage is a surgical procedure that helps to reinforce a weakened cervix and prevent premature birth or miscarriage. It involves placing a strong stitch around the cervix to keep it closed and support the weight of the growing baby. The procedure is typically performed between 12 and 14 weeks of pregnancy, but it can be done later in pregnancy if needed. Before the procedure, the woman will receive anesthesia to numb the area and help her relax. The surgeon will then use a speculum to open the vagina and visualize the cervix. There are two main types of cervical cerclage: Transvaginal cerclage is the most common type of cerclage. The surgeon places the stitch through the vagina and around the cervix. Transabdominal cerclage is less common and is usually performed if the cervix is too short or weak to hold a transvaginal stitch. The surgeon makes an incision in the abdomen to access the cervix and place the stitch. Once the stitch is in place, the surgeon will check for any bleeding and make sure the cervix is securely closed. The procedure usually takes about 30 to 45 minutes. After the procedure, the woman will need to rest for a few days and avoid strenuous activity. She may experience some mild cramping or spotting, which is normal. The stitch is usually removed around 36 to 37 weeks of pregnancy, allowing the cervix to open naturally for labor and delivery. Section 5. Navigating the labyrinth, technical challenges and considerations. While cervical cerclage is generally a safe and effective procedure, it's not without its challenges. As a surgeon, I've encountered various technical considerations that require careful planning and execution. One of the primary challenges is the variable anatomy of the cervix. Each patient's cervix is unique, with differences in length, shape, and position. This requires the surgeon to adapt their approach and suture placement accordingly. In some cases, the cervix may be short or difficult to reach, making suture placement more challenging. Another consideration is the timing of the cerclage. Performing the procedure too early may increase the risk of complications, while delaying it may not provide adequate support to the cervix. The optimal timing is usually between 12 and 14 weeks of pregnancy, but this can vary depending on the patient's individual circumstances. Infection is a potential risk with any surgical procedure, and cervical cerclage is no exception. Maintaining strict sterile techniques during the procedure is crucial to minimize the risk of infection. Patients may also be prescribed antibiotics after the procedure as a preventive measure. Finally, the choice of suture material is an important consideration. The suture must be strong enough to support the weight of the growing baby, but also biocompatible to minimize the risk of rejection or irritation. Section 6. Triumphs and tribulations, success rates and potential complications. Cervical cerclage boasts a commendable success rate, with studies reporting that it helps prevent preterm birth in up to 80 to 90% of women with cervical insufficiency. This means that the procedure significantly increases the chances of carrying a pregnancy to term and delivering a healthy baby. However, like any medical procedure, cervical cerclage carries potential risks and complications. These are generally rare but can include premature rupture of membranes or PROM, where the amniotic sac surrounding the baby may rupture prematurely, leading to preterm labor. Preterm labor itself, as the cerclage may not be successful in preventing preterm labor in all cases. Infection, which is a small risk after the procedure. Cervical laceration or rupture, where the cervix may tear during the procedure or later in pregnancy. Bladder or bowel injury, which can occur in rare cases during the procedure. It's important for women considering cervical cerclage to discuss the potential risks and benefits with their doctor. They should also be aware of the signs and symptoms of complications, such as vaginal bleeding, cramping, or fluid leakage. Despite the potential risks, cervical cerclage remains a valuable tool for preventing preterm birth and improving outcomes for women with cervical insufficiency. The procedure has helped countless families welcome healthy babies into the world, and its continued advancement offers hope for even greater success in the future. Section 7. The future of cervical cerclage, advancements and hope. The field of cervical cerclage continues to evolve, with ongoing research and technological advancements paving the way for safer and more effective procedures. One area of focus is improving the diagnosis of cervical insufficiency. Researchers are exploring new imaging techniques and biomarkers that could help identify women at risk earlier in pregnancy, allowing for timely intervention. Another area of innovation is the development of less invasive cerclage techniques. Minimally invasive approaches, such as laparoscopic or robotic-assisted cerclage, could potentially reduce the risk of complications and shorten recovery times. Furthermore, researchers are investigating new suture materials and designs that could further improve the effectiveness and durability of cervical cerclage. Biodegradable sutures, for example, could eliminate the need for a second procedure to remove the stitch later in pregnancy. The future of cervical cerclage is bright, fueled by a commitment to improving outcomes for mothers and babies. As we continue to unravel the complexities of cervical insufficiency and refine our surgical techniques, we move closer to a world where every pregnancy has the best chance of reaching its full term.